Good afternoon, colleagues. Welcome to CanAIRy Learn's second Tech Talk. My name is Amos Mwangi, Senior Associate for WRI Africa. And on behalf of WRI Mexico and WRI Africa, I want to welcome you to this new session of our Air Quality Community of Practice. The focus of today's session will be CanAIRy Alert Air Quality Forecast Tool, and we are looking at empowering African cities with air quality forecasting. For those of you who may not be aware, the CanAIRy Alert is a partnership supporting air quality practitioners in the Global South to have access to data and tools and better understand its sources. Our goal today, as I mentioned, is to enhance the capacities of local governments and also to use the CanAIRy Alert forecast tool. And we are seeking to draw insights that can inform the citywide interventions and plans. And so the way we are looking at this, we'll be listening to one keynote speaker, and then we'll hear experiences from 3 experts using the air quality forecast tool. And finally, we'll have a space for comments, questions, and then any other thing that would come up. So at this point, I would like to hand it over to George Moneki, Doctor, who is the head of our air quality team in Africa, to take us through the next session. Over to you, George.
Thank you very much, Amos. Just to put everything into perspective, 1.5 years ago, we launched the CanAIRy Alerts project, and we had many representatives from Africa and both Latin America. The project mainly is aimed at developing tools and availing them to practitioners in Africa, air quality practitioners. As you might know, this is part of the world that air quality data is quite unavailable. Most of the tools developed here initially were meant to use reference grade data, but because Africa, we do tend to have a lot of low-cost sensors. So the pilots, the pilot tools, we try to use low-cost sensor data to kind of gauge how well can they provide the insights or the forecasts that we are looking for in this tool. Today, we are very happy to have some few distinguished presenters, and we are going to start with a keynote from Victor Ndusi. Victor Ndusi is a consulting research fellow at the Health Institute. He is an environmental scientist with a focus on environmental monitoring and assessment in both atmospheric and aquatic compartments, that is air, water, and biota. Victor has over 10 years of experience in environmental health and pollution control, and has delivered on projects and consultants across Africa, Asia, and Latin America. He has extensive experience in environmental monitoring and policy evaluation, and contributes expertise to various initiatives aimed at promoting improved air quality in East Africa.
Thanks, George. And it's a pleasure to be with all of you. So unlike the presenters after me, I will talk less about actual forecasting and more scene setting in terms of why we are here. So I'll give a 3-part presentation, one part focusing on the health side of the air pollution discussion, a second part looking at what the evidence is out there, and maybe a final part looking at the role of data in air quality management. Colleagues after me will probably speak more about the forecasting and where it fits into all this. So to begin with is a general question, interesting question. WASH, as we know it, water, sanitation, and hygiene, has been an issue on the continent. So the question here is it responsible for more deaths than air pollution in Africa? So think about this, ponder about this, and in the next couple of slides, we'll see whether indeed this is true or false. I would argue both answers are correct depending on when the question is posed. So let's begin in 1999. This is a screen grab of the global burden of disease that started in the 90s, 1990 actually. And at this point in time, you can see that malnutrition is high, up Water and sanitation is also very high. Unsafe sex, HIV, as we know it, was a big killer on the continent, and air pollution comes fourth. Not the numbers on the screen. On the x-axis down here, it goes up to 2 million. Air pollution sits at 1 million. Let's take it forward 10 years. If I click, okay. This is 2009. So you begin to see now a shift. So malnutrition is still up there, WASH is third, unsafe sex, HIV, that kind of thing is second on the list. Air pollution is now creeping up to third on the list in terms of the causes of death in sub-Saharan Africa. Note this is both sexes, male and female, all age groups from 0 to 100 plus. Fast forward again another 10 years to 2019. We still have a malnutrition problem, but the air pollution problem is now sticking its head out. So it's second on the list. One thing you will note is that the numbers haven't moved much over this 30-year period that we're looking at. Air pollution has been responsible for, these are estimates, so between 0.9 to 1.1, 1.2 million deaths. What we are seeing is what you could describe as an epidemiological transition. So less infectious diseases as ministries and countries focus a lot on infectious disease and an increase in NCDs. And these are things that, if you think about it, within your locality, NCD incidences are going up, whether that's cancers or many other diseases. So, you begin to see that air pollution is becoming increasingly an issue that we should focus on from the health side. And when you talk about health, there's two things we speak about in terms of air pollution. So there's short-term immediate effects that are caused by, exposure when you're walking down the street, depending on where you are, indoors or outdoors, aggravated cases of allergies, asthma, COPD, and other things. Emergency room visits, having to go to the hospital and things like those. And the long-term ones, which, as we say, air pollution is an invisible killer. We tend to live with some of these diseases and not perceive them as having been originated from pollution exposure. Lung cancers, diabetes, strokes, chronic heart and lung diseases, reductions in life expectancy. And I would argue also we are still discovering more as we delve into this issue. So a few years ago, PM10 was perhaps a pollutant of interest. Now it's PM 2.5. We know now that it goes way beyond your respiratory system, goes into your, other cardiovascular, reproductive, heart, many of these systems that you see in the image on your left, therefore, being attributed to various diseases as we go. So these two short-term and long-term issues come to the fore. And we speak about mortality, the number of deaths, but more importantly, morbidity. So the diseases we have to live with. And that takes a big toll on productivity, if you think about it, economic and otherwise. So just to emphasize that these are estimates, and this is just a quick diagram to show how these estimates are arrived at. And at every stage of this diagram, you begin to see gaps in the African context, whether that's determining the exposure level in terms of monitoring data, satellite data, ground monitoring, and all this into one mix, model this out, compare that with the dose response functions, then you end up with the burden of disease. So if you focus on the right, on the left, enough, we need to expand our monitoring infrastructure basically on the continent. If you focus in the middle, we need to, kind of expand the number of health studies that we are doing so that the dose response relationships are more quote unquote comparable to our populations, depending on, the population mix and all that. Then we could possibly arrive at better estimates in terms of burden of disease. So in terms of the work that I've been doing recently, just to say that we do not lack evidence per se. I think it's there. It's just how this evidence is communicated and portrayed to the people who could effect change, be that policymakers, mostly in most cases. So here I show an interactive literature database that we put together at HEI, focusing only on East Africa. So 8 countries in East Africa, excluding Somalia, and including Ethiopia, which is not part of the EAC. 180 plus articles in terms of published peer-reviewed articles in these 8 countries. Of course, the darker the color, Kenya, Uganda, more studies there. So we are taking this a bit further and doing a scoping review to actually summarize what kind of studies these are. And, you know, are more people focused on indoor air pollution, outdoor air pollution? If so, what health outcomes are people looking at? Is it child health, maternal health, respiratory health, et cetera, et cetera? And, you know, the photo here just shows you our panel of experts who are helping us to do this. We have protocol that's published. If you're interested, this slides will be shared with you. The link at the bottom takes you to the protocol that shows you, you know, how we intend to go about this. So I think the message here I'm trying to portray is, as we think about forecasting and all these tools that are available to us, we have a wealth of evidence, a wealth of knowledge that we can begin to use in order to build the kind of action that we would like to see. And, you know, as I will demonstrate in my next couple of slides, is that this action needs to happen, and it needs to happen now. So I'll use a case study to demonstrate that. It's a bit outdated, but I will use it anyway. So clean air action planning is something that's sort of very new in our setting to our cities. So what you see on your left is an example of a 7-step pathway to arriving at a clean air action plan. If you're a city X, Y, or Z, it could be more, it could be less, but for the sake of argument, let's assume we have the 7 steps. So let's take an example of 2 cities, Nairobi in 2018 and Kampala in 2022. Immediately you notice for Nairobi, you have what is a 7-step process coming down to 4 steps. Why is that? At the time that this clean air action plan was being developed for Nairobi, there was no data to go with. Therefore, step 2 and 3 are kind of skipped, so to speak, in quotes. So you end up in a situation where you have to determine policy priorities in the absence of data. Looking at Kampala, you see 6 or so steps. Why is that? In Kampala, at the time of developing the Clean Air Action Plan, we had a 4-year, we were actually able to put together a 4-year data set that was acceptable to the city. And these are people who, it was not necessarily city data. I should stress that as well. But the people who were monitoring and having this data were in liaison with the city. So the city was able to accept this data and use it for their planning. And that's why you see that much difference. I should also say that this is a 4-year difference. Nairobi is not where it is now in 2024. It's very different from where it was in 2018. And then this just goes to show, you know, to the importance of data in decision making and in planning. So what's the end result of this? So you have a situation where one city is setting goals, such as establishing monitoring networks, developing communication strategies. Even when you look at the control measures proposed here, they are not really control measures. So things like developing air quality legislation and things like those. Very, very fast initial stage kind of things. Then you have another city setting goals, but on top of goals, and in the case of Kampala, setting actual targets because they have numbers. So in the case of Kampala, they set targets and said, we want to reduce PM 2.5 by 10% by 2025. We want to reduce NO2 by 20% by 2025. This is based on baseline data, 4-year data set, baseline levels. All that is in there in terms of the numbers, the actual numbers. You could argue that this is very ambitious, and you would be right. But the counter argument to that, if I just click and you'll see the diagram there, a typical day in Kampala, you have lots of traffic, lots of border borders, as we call them. The counter argument that you know, at first the city says, oh, this is too ambitious, we can't do it. But you have to sit back and think about life goes on as usual. So people will still be importing cars, population growth will still go up. The drivers of environmental change that are causing all this pollution are going up year by year. And the rate of urbanization in Africa cities is also high. So by setting these targets, you may not actually achieve them, but what you could achieve is actual reduction in terms of it could have been much more worse with the rate of urbanization, rate of increase of all these environmental drivers of change. So that's with that argument, the city was able to sit down and say, oh, yes, we think so. So let's go by these targets. We may not achieve them, but we could possibly show that in these efforts that we're putting in place, the measures that we're putting in place, we're able to have reduced, what could have otherwise been a big toll on health and the economy of the city. So that's most of what I had for this session in terms of setting the scene. I haven't talked much about, air quality forecasting, but hopefully I've shown the critical place that data plays in this discussion. And maybe just to close off, some considerations, some challenges that we still do have as a continent would go in maybe these three buckets. Evidence, institutional, and financial. The evidence-based piece, I think, is something we are working on with our research institutions, and a lot of interest in terms of funding coming into the continent to deal with air pollution, etc. And a lot of discussion in terms of actually integrated action, not just air pollution, climate change, circularity, all those discussions, I think, are lending to that. Concurrently, with the evidence, the institutional piece is also falling in place. I think the one place we may want to put some emphasis on is the financial bit. Some of the actions of changes we would like to see actually happen at sectoral level, if you think about it, whether that's transport, industry, waste, etc., etc. We need a lot of financing to go into some of those projects. Private sector involvement, government, private sector, PPP, whatever seems to work. And I think that's the bit where we would probably want to put a bit more emphasis and effort in the discussion. Maybe not today, but over time, so that we see to it that we have sustained action and easily implementable measures that we're putting in place. So that's my brief opening remarks. I'll turn it back to George, and look forward to the discussion and hearing more about CanAIRy Alert and more of the forecasting from colleagues. Thank you.
Thanks, Victor, for that insightful presentation. But I want to give Victor two questions that he should be thinking about. You don't have to answer them now. You'll answer them towards the end. And the first one is a very interesting surprise for me, that for 30 years, the period that we showed the health effects of air pollution in Africa, is kind of the number has remained static at 1 million. Does that mean air pollution has not worsened, or we have learned how to deal with it? So this is one of my questions, but you don't have to answer now. The other one is on coverage. I really look forward to seeing that report on the number of publications we have from this region. And if you don't mind, start thinking, what is the coverage when you talk about Kenya? How many of them are in Mombasa, Nairobi, Kisumu, Nakuru? Because we can have all of them concentrated in one region. And also, I am in the understanding, I saw Dr. Gatari is with us today, so he has some very interesting insights on this. Most of these studies are very geared towards research. So the equipment are usually located in very high traffic areas or in waste burning areas. How does that impact the quality of data we get? Those are questions that you should think about. I'll repeat them again towards the end of the session. So thank you, Victor. And now we have the advantage of listening to the lady who spearheaded the development of the air quality forecasting tool, Miss Christine Mothe, who is an air quality consultant at WRI. Christine is a data scientist and AI researcher with over 5 years of experience in running mathematical models to describe the world. She has worked in data mining, trend finding and building machine learning models for predictive analytics. She is currently a PhD student at Carnegie Mellon University and also an unresident fellow at the Atlantic Council Geotech Center. Christine, the floor is yours.
Thank you, George. And I am so excited to just talk about the work that has been done before in CanAIRy Alert. So this is more like speaking about the work that has already been done, while looking ahead to what needs to be done to facilitate or to empower African cities with focus. Okay. So the first question I had to ask myself is why should we empower African cities with focus in the first place? And I found that it is very interesting that African cities continue to grow. In the last decade, we've had a growth of over approximately over 3.5% per year growth, and it's continuing to grow exponentially in the next decade. So we'll have cities that are rapidly growing, and in that we need to have studies and research that more or less facilitates the growth of cities in a sustainable way. The third thing is that we have freely available global investments in air quality that we can, as African cities, can leverage to build on that research to make insights on air quality, build on what is already existing. So it's more of an advantage of having people go ahead of us. So we're more or less using those tools to build on that research and to tailor it to the context of African cities. And the last thing is we need to, by having focus, we are able to mobilize meaningful action on air pollution. It's interesting that we are able to have action plans, but right now in light of seeing that we need evidence-based action plans, we need to plan to establish them in the institutions in which they will have the most impact. And even financially, it would make sense to invest in an action plan that you'd find results, so that we end up investing resources in what needs to be done. So why we need to empower African cities with focus is that we are able now to know where do we target these action plans to reduce air pollution. So on the same subject of building on existing work, CanAIRy Alert was built on top of TAQ project, which was a successful pilot that was done in Latin America. So we had early observation from monitoring stations that some used local sensors, some used reference grade instruments from 2018 onwards. And we had pollutants like ozone, nitrogen dioxide, and particulate matter. And the participating cities included cities in Latin America: Guadalajara, Monterrey, Guanajuato, Bogota, Sao Paulo, and Mexico City. And some of these insights can be seen in the tool called Resource Watch, which is hosted by WRI currently. But now in CanAIRy Alert, we wanted to pilot this for a few African cities that we saw that had the potential to grow or have focus that can be used as a pilot for other cities to use from our study. So we started with Nairobi, Kampala, Kigali, and Accra. It's not Kumasi. And from Nairobi, we had local sensor data and reference grade monitors. From Kampala, we had a wide network, as I will show you in the next slide, of local data and reference grade monitors. And in Accra, we got local sensors. So we combined both of them just so that we can get a spatial representation of what we have on the ground in terms of ground monitoring. So, so that I just demystify what CanAIRy Alert really means. It's just combining, globally available forecasts that are available on GeoCF. And since that global forecast is more of it's a low resolution. You're able to get 25 by 25 kilometers resolution, and that really, to be honest, does not really make sense when you want to make a focus for subnational on a subnational level, on a city level. So we had to scale that down to produce station level focus. And there was no better way than using local sensors and reference grid monitors. And combining these two data sets, we would use machine learning so that we can learn these patterns from the ground data, and we could produce so that we can produce forecasts that are more tailored to be closer enough to what is happening on the ground. So we would combine them. The process I will explain it in the next slide, but it involves just getting data from local sensors and reference grid monitors. The data was calibrated, but we had to have internal QA/QC protocols because of some of the issues that I will describe later that we saw in the data. The data had to be cleaned, and then we had to combine it with the GeoCF data. And using machine learning or more of a bias correction, we're able to combine those two data sets to form a station level forecast that would be run daily. Therefore, now you'd be using more of the patterns of the ground level data, but you'll be producing them using some of the insights from the global level forecast. And you'd produce forecasts that were 5-day forecast. And from there, you would reevaluate the output of the forecast to make sure that at least you're maintaining the forecast is still on high scale. You're able to produce something that is close enough to the ground. And the metric we'd use to do that was mainly accuracy, root mean squared error, but some of the metrics we'd use to evaluate whether the forecast is close enough to the ground level are going to be discussed later. All right, so let me explain some of the characteristics of the data that we received from our partners so that we can understand what is this data that is fed into a machine learning model and combined with global level forecast so that we can produce a station level forecast that we can use to have insights for a city. So from Nairobi, we received reference grid monitors data. There was also some data from PM 2.5. The data was calibrated, and we received data for 1 year. And after evaluating the data, we found it fit for forecasting. From Kampala, we had a wide network of local sensor monitors, and we received data for both PM10 and PM 2.5. The data was calibrated. They have an interesting, AIRCO has an interesting paper on using machine learning to calibrate local sensor data. And the monitoring, we had unlimited access because they gave us access to their API. So all we do, we would hit the APIs and get access to the data, continuous data. And we found that the data was fit for bias correction. From Kigali, we got 3 locus monitors data and 1 reference grid monitor. And it had PM 2.5, PM10 ozone, and CO, carbon monoxide. And the data was calibrated. We had 1 year of continuous data, and we found the data, some of the data was fit for training the bias correction algorithm. From Accra, we got 6 locus sensor monitors and 1 reference grid monitor. It involved both PM10 and PM 2.5. Most of the data was raw because of some of the issues that we face on the ground while establishing these monitors. And the data was sent in batches. So there are challenges that are involved in collecting data from the ground. We acknowledge that. And some of the data was fit and some was unfit for training the bias correction algorithm. So, we might want to operationalize the forecast right here in Africa. But what are the challenges of having an operational forecast in Africa? We thought that this would be such a seamless process like what we had read in CTAQ, but it turns out that in Africa, it was a different story. The challenges that were involved in Africa were not the same challenges that were in Latin America. So the first the first issue encountered was data quality. And the other that we need to discuss is the robustness of the forecast. How do you trust a forecast after you've seen that sometimes it is not in line with ground data? So this is a very busy graph, but all I'm trying to, I would try us to see some of the issues. The data evaluation process involved getting data received and pre-process them for training the bias correction algorithms. So in addition to the partners' calibration protocols, the partners submitted their calibration protocols, but we had to have internal QA/QC procedures because even with data that had been calibrated, we still found issues with missing data. Sometimes you'd find lags in data, and then now we start seeing noise at the end of the monitoring period. Sometimes you would see constant or single numbers over a period of time. And yes, some of the data was not calibrated, and would see inconsistency in logging times, maybe due to downtimes, due to internet access or some power outages, or sometimes you'd find some really aggressive pollutants near the source. Would find missing data, negative values, and actually persistent values over time. So what was the effect of this? The data gaps that were in the data that would be useful for training would be translated into the forecast. So here we can see that in Bugolobi here, you'd find if there was a gap in the training data, we did not really want to remove it. Essentially, we would want to remove it because you don't want inconsistencies, but because of so that we can communicate the issues that having missing gaps, what it causes, we had to actually show that when you have data gaps in the training, you will have data gaps in the forecasting. So when you are trying to correct the bias, you'd find that we had some missing values around the same time. So from this graph, you can see that we are trying to make sure that our model produces an output that is close enough to the ground level observation, because that is what we rendered as our true, let me call them the true or the gold targets. Yeah. So as much as you are able to reduce some bias from this graph, you can see that before bias correction, we had a lot of bias in the data. We would calculate it, and there was a large error. The difference between what the model was producing versus what was on the ground was really large. But after performing the bias correction using machine learning, you'd find that the root mean square, which is a metric we use, would become smaller, but would still have some issues with the missing data. So about the robustness of the forecast, I don't know whether it's safe for as a machine learning expert to say that there is no perfect algorithm, but it is true. Algorithms are as perfect as the data that is used to feed them. So right here, this is the time now we took the model for testing, where now we would see this is what the GEOS or the forecast would produce, and then we would compare it with ground data at that particular time. There were times we would find moments of inconsistencies in that the GEOS would overestimate. Sometimes the GEOS would underestimate. And at other times, you'd find that it was completely off. Maybe, and I will explain the issue with that. Because sometimes it's overfit, or it fitted to even the noise in the training data, that when you go and test it on new data, it behaves completely different. So one of the confounding factors that we observed were some ground level disturbance, either during training or even during testing. In this graph, let me move this up there. In this graph, we received insight that this was the time we had the Harmattan winds. So this is something that maybe the model would have picked up, but did not pick up during training. So there was a ground level disturbance that made the model go completely off what we expected. So there is overfitting or underfitting to the training data. when you have overfitting, when you come and test the data, you'll have a poor performance. And you're underfitting, you'll find that it is not really the model is not really understanding the complex patterns in the data. Some of the data was insufficient for training, and the spatial representation, caused by coarse resolution. The spatial representation error, caused by coarse resolution, and some of other irreducible errors within the data that, of course, can be accounted for with a very good uncertainty budget. So in this, there is just one thing I would like to highlight. We're still on the same case of understanding how robust, how trustworthy is our model. So you'd find that we compared the GOCF, the data in comparison to the ground level, just to see whether we had a good correlation. And we found that sometimes GOCF was overestimating most of the observation, except in the event in Accra. And we observed an instance of overfitting in Nairobi. So in Nairobi, during training, it would perform very well, but during testing, we would find that it performed quite poorly. And in other areas, you'd find during training, it's performing, the performance is just okay. And during testing, you find, wow, it is really understanding some of the trends in the test data. And we find that we introduce a generalization term just to ensure that the model is good at generalizing the results. And the instance of underfitting, it results to poor results, just like I have said in the CanAIRy University that you can see here. When you have instances of underfitting, you'll find that even in the test set, you'll have quite a poor performance. So enough of the numbers. So more on a practical sense. So this was just an instance where we just deployed the model and observed how it's behaving. So right now, I'm very sure the website has been worked on and it looks better, but this was on the first instances when you were testing it on the ground. So on 11th May, 2023. So just while I was observing the behavior of the model, I observed that in like 5 days you would have a high pollution episodes, but we left it and I just communicated, okay, we are likely to have a high pollution episode, but much later, I don't know whether Maurice is here, but he raised an alarm that they picked this from an air monitor, and he sounded an alarm. I think we need to get more air quality landscape on this particular place. And for sure, it was the area where we had forecasted a high pollution event. This is just to tell you that even while we were in beta testing, we could see how these forecasts would be operationalized, would raise an alarm on some of, would raise an alarm on how you can go about reducing a likely pollution event. If this was just in testing, how much more can we do if we operationalize this model and we're able to be keen to look at, okay, if there is a focus of a high pollution event, what can we do to make sure that we counter or warn people or just be aware if we cannot do anything about it. So a big shout out to Maurice. I don't know whether he's here, but he raised an alarm to everyone, to George, to Christine, and I know some of the people are here, but this just tells you how eager the cities are ready to use and operationalize this tool if they perform just enough. So the last thing I would like to say is, now that we have a tool that can be used, it may not be the most perfect tool and it has its flaws, but we can see that there is a potential for utilizing this tool in a city's context. What needs to be done is that we need to update the model on the current data. the stats that I produced here were from a while back, the assessment that I was doing. But right now, the model is performing quite differently. So there is need for more data to update the model. The second thing, there is need for guidelines on the criteria of data acceptability, so that the data that we receive, we know that we can render it as good enough to produce a model. If you not remember anything from this presentation, remember that a machine learning model is just as good as the data that is used to train it. And operationalizing the tool needs frequent audits and feedback. And I really appreciate the Nairobi City government for just being there to constantly do frequent audits and tell us this is going well, this is not going well. And with that, we will be able to equip African cities to make forecasts that are practical and are actionable on a city's context. Thank you so much.
Thank you, Christine, for that. Very inspiring. I always learn something new, even after looking at this model for a year plus. I just want also to appreciate the data providers. I can see 3 of them here. Data from Ghana was shared by Kofi, who is here. Data for Uganda was shared by ECHO. I can see they're represented by Gideon. And data from Nairobi was shared by University of Nairobi, Dr. Gatari, Professor Gatari, and I can see he's here. So really appreciate those teams that provided the data. And also I can see in the team, we have Kezia from Mexico, who is doing the validation of the model. And she has a few challenges. She wants to get more data for 2 years to do a better validation. So I'll be following up with an email to make sure that we do this. Before we go to the next speaker, there is a few questions I want Christine you think about so that you can tell us more towards the end of this. One of them is the difference in monitoring. I know the satellites data are using kind of grids, which are, I think, are 25 by 25 kilometers. And monitoring station is more of a point monitoring. So how do those affect how well this tool works? And how did you see that in your analysis? The other thing I would ask you generally to talk to the data providers and see how can they really work to help, because I believe this community of practice for Africa, the data providers, people who are developing the tools, and also people who are using these tools, and also I can see Selela in the team. How can we help each other to make work easier in Africa? So thank you, Christine. And now we go all the way down to the south. We are done with the East Africa. And there we meet Kusana Jafta, who is a senior lecturer and a researcher in occupational and environmental health at University of KwaZulu-Natal in South Africa. His research interests are in environmental and cancer epidemiology. He has been part of teams that has obtained several competitive grants and scholarships from different agencies locally and across the world. He has over 20 published papers in peer-reviewed journals, and he has presented most of his work at national and international meetings and published 2 book chapters. So, Jafta, the floor is yours.
Thanks, George. Good day, everyone. It's a pleasure to be invited to present here. I'm an environmental epidemiologist, meaning I'm interested in health. I'm going to talk just on low-cost sensors for air quality data collection. If we look generally in air pollution across the globe, it's deteriorating due to emissions. The main, or what is high up in the risk is human health. It's known that air pollution contributes to climate change, to loss in biodiversity, and also waste in general. But human health is usually up there. That's why I put it as the thing to focus on. When you look at the UN UNP report, the 2021, of the countries that are producing data or are collecting data on air pollution, 51 nations explicitly refer to public health. Others, is public health and ecosystem. But 49% of the countries are only interested in ambient air pollution. So they don't link the air pollution as a necessary risk to health. But it's just described as just an air pollution as a nuisance. So recently, or even way back, there have been sensors that have been developed. If you come to think about it, way back we knew that in the kitchen there's a smoke detector or there's a CO detector that would pick up any fire that happens in the kitchen. It was way back before we even understand how these things work generally. Usually the low-cost sensors are one or more devices that are put together. Their main focus is to measure specific pollutants such as PM as well as carbon dioxide and so forth. Sometimes these sensors can measure meteorological parameters like temperature and humidity. In recent years, the uptake of these, especially in the field of air pollution, the uptake have been rapid, and the need for these low-cost sensors have been recognized as very important because of the costs that are going up every time when you use the traditional instruments. The evolution of air sensor technology have made even these sensors more attracting because they are smaller, they are less expensive, they could be used widely. It means instead of having one monitor, you can at a cost of a certain amount, you can have maybe 5 or 4 monitors around the same area, but with a better resolution. Then the definition of what is a lowest cost and low cost sensor is it varies. But one thing for sure, compared to the traditional monitors or traditional fixed monitors, the low cost sensor is usually hundreds less than or thousands less than the traditional monitor if you were to compare price-wise. These low-cost sensors are usually electrochemical sensors. They are based on chemical reaction of gases, nitrogen dioxide, sulfur dioxide, ozone are some of the gases that could be detected using electrochemical sensors. Another sensor that is widely used is a metal oxide. This one, again, there is a reaction that happens in the sensor, and then you can detect your nitrogen dioxide, ozone, and so forth. If you look at the first two that I'm mentioning, there's a chemical reaction happening, or there's a reaction happening. But with others, they use light as a way of detecting or measuring whatever is measured. For example, VOCs, it uses light, and also the PM, the optical particle counter, it uses light as a way of measuring the concentration or the amount of particles in the space. Optical sensor is another one that is also used as a low-cost sensor. The characteristics differ depending on on the make as well as what it's measuring. Usually those low-cost sensors have got a limited lifespan, 3 to 10 years sometimes. Accuracy is impacted usually by accuracy and precision it depends on where the measuring is done. It depends on time where it is used. If it's a heavily polluted area, for sure that has an impact on the lifespan of the sensor as well as accuracy and precision. And the methods of processing the data are also important when it comes to how accurate the data is. I think you heard the previous speaker talking to that, how the data should be so that it's the processing as well is good as the data that comes through. Temperature and relative humidity are other variables that are very important when it comes to these sensors. In areas where these are long coastal areas where you get high humidities, the sensors will behave differently to when you are in a dry areas. The presence of multiple contaminants in the air are also important because there could be a cross reaction between the sensors or within that sensor. The choice is usually dependent on what is your purpose when you want to use these sensors. If your purpose is you have defined your purpose of why you want to use these sensors, preferably you will also look at the range, whether the range you're likely to measure the sensor is adequate for that. Whether the sensor, how accurate it is, the resolution, how many measurements it takes, for example, per minute or per 10 minutes or per hour, the response time, chemical sensor will be much more slower than a light sensor, the one that uses photo light. The working conditions, as well as things to take to consider, as well as storage conditions. So some people have looked at these sensors and compared them to the traditional monitors like the TOM. This is one study by Wang, published in 2021. If you look at the figure, we realize that there are three low-cost sensors here. The one on the left, the ideal measurement would be the dotted line. The one on the left is not far from the perfect measurement of if you were to use a TOM as a standard. The other one, PDR, is a bit at higher concentrations. It overestimate, but at lower concentration, it underestimate. Again, correcting this, someone has to have an insight on how this work and so forth. With the sensor tree, as you can see, at lower concentration, there is an underestimation compared to TOM, but as you go higher in the concentrations, it overestimates the PM levels. This is an example of how useful these sensors could be if they are used in space and time. On the left is an example of how these sensors were deployed, and with raw data presented as a green. On the right is a concentration over time. the raw data, when it's corrected for relative humidity and temperature, it's high here, or it's lower. It's high, sorry, it's high. But when it's modeled, it's again high, the raw data. But one thing for sure with these sensors is that they track the raw data, which is a good thing in a sense. This is a figure from Mead et al. It's showing how these sensors could be used. You could create a hub, different hubs, or you could connect those hubs, as you can see in the middle diagram. On the right, as you can see, you can even connect different nodes such that you create a big network. So the low cost sensors are useful because of one of the things is that you can cover more space spatially. I think the last speaker, Christine, has talked to this, how you can, how the processing of the data from generally the sensors, the low cost sensors, this is a similar process to how even the traditional monitors, the data would be processed. You start on multiple sensors feeding to a certain node, and then that data is goes through different stages until it ends up on the phone as a warning after it had been after the forecast has been done. Coming back to Africa, there have been some institutions that are now focusing on Africa, especially using the low-cost sensors. This is one institution, and I didn't put the link here. As you can see, it's across Africa. It's a multiple institutions across Africa, in West Africa, in East Africa, as well as in the Southeast. So the key about these institutions that they support the use of low cost sensors and their usage. They will help whoever wants to start to install, and also help with how these low cost sensors could be used. Calibration as well, they also advise on calibration and guide, and also guide people on how to process the data, whoever wants to. I know in the South, there's only one institution that is involved in this, but after this, I think I've come to realize that we are not fully using even the institution that is there to get and use the data. There have been some publications that show how extensive or how the uptake of the use of low-cost sensors are in Africa in general. These are some of the examples of the publications that have come out on using low-cost sensors. For example, there is one in DRC and also Congo. There's also one in East Africa. I think this one includes multiple cities. I think you can even recognize some people on the call here. There's also one which is from Nairobi, and also others from different countries. But the key here is that I think Africa is realizing that these low cost sensors are usable and could be the way to address the air pollution issues. In the state of global air report, the 2022, if you were to just focus on it, you look at how Africa looks like, you realize that the diagram on the left shows that it shows different levels, average levels per country. But that picture is not accurate because that report for Africa is based on if you look on the lower right diagram, there are only 5 countries that are shown here that supplied or that estimate that provided data for the estimation of air pollution in Africa. So there is a gap in a sense that data from Africa is not as extensive as it should be. It's very sparse. Just to talk to that issue, if we were to look at health studies that have been done in Africa that use sensors as the exposure data, you'll realize that there are quite few. And most of these studies, this is adapted from Amega's 2018 publication. It's just few editions. But if you look at this, it's only PM and PM, ozone, and carbon monoxide that are pollutants that have been measured and been used in epidemiological studies. With epidemiological studies, as the other speaker said, you need that exposure response to be estimated accurately, such that you are able to see the associations. So I think this is a show that low cost sensors are still far being used, especially in health studies, as much as there are studies that are done in measuring air pollution in general. In conclusion, particulate matter and carbon monoxide are the most monitored pollutants in sub-Saharan Africa, and the uptake keeps going up, and hopefully it's useful. But again, it's the expertise that we need. I think institutions like WRI will be able to bridge that gap, because you don't just collect the data and use it. You have to process it through that. More institutions, centers are making data from low-cost sensors available and are supporting it. I think I showed that with the Africa Air Institution. There are others which are also doing similar work. Manufacturers are improving the quality of low-cost sensors for monitoring air pollution. And I think as we move on with the expertise developing in the processing of this data, together with the manufacturers improving the accuracy, the precision, and how these sensors work, will get better. Thanks.
Many thanks, Nkusona, for painting that very grim picture, which has always been our understanding that Africa really, in terms of air pollution, we are not doing a very good job. And even a bigger question, how well do we understand air pollution in Africa? And I think from your presentation, it's very clear to see that we don't have a full picture. We probably just scratched the surface. We need to understand this more. which makes me very curious. The health data that Victor shared earlier, then if it's generated from the same kind of studies, it might be showing a serious underestimate, because from your map, you could see actually the most polluted areas is where we have the least studies. So thank you very much. And one of the questions I'd like you to think about is if a policymaker came to you and asked you, what can you advise me on the use of low-cost sensors? Not a scientist, but a policymaker. We'd like to hear what kind of advice you would be giving to such a policymaker. So thank you very much for that. And now we move all the way to West Africa and welcome Mr. Kofi Amega. He is an associate professor of environmental and nutritional epidemiology at the University of Cape Coast in Ghana. He leads the Breathe Accra project. His research group focuses on the interface of nutrition and air pollution exposure effects on adverse maternal, prenatal, and cardiovascular health outcomes. They also explore the biological mechanism mediating air pollution health effects among vulnerable population. He recently established a birth cohort in the Cape Coast metropolitan area with the primary aim of unraveling cellular and molecular mechanisms and identifying social and nutritional modifiers of household air pollution health effects. Kofi, those were very technical terms, but the floor is yours.
Okay, thank you, George, for such a very kind introduction from you. And greetings from Cape Coast, Ghana. And Cape Coast is the colonial capital of Ghana. Very lovely city to be in, and I invite you to visit. And let me thank the organizers for also the opportunity to speak at this tech talk. The task that was given to me is a very huge one. I was asked to assess the air quality data gaps in cities in Africa, which is a huge one, but at least I have tried my best to compile something to stimulate some discussion after all the talks. So this is a paper that I wrote with a colleague at JMensa, University of Ghana, and I think it's still relevant today, even though the paper is, well, some 8 years old. And here we try to articulate the burden of air pollution in sub-Saharan African cities, try to proffer some solutions within the framework of the Sustainable Development Goals and the World Health Assembly resolutions on air pollution and health. And it's still relevant today. Unfortunately, the issues are still with us and hasn't been addressed fully. And one of the main things here are the data gaps, which I have been asked to speak to. So these are the frameworks, the SDGs, and then the proposed actions that we have, which we think once we implement these proposed actions, then it doesn't, as it addresses the air quality problems, then certainly it also leads to achievement of the Sustainable Development Goals. I mean, the two previous speakers have highlighted the air pollution problems on the continent, but just to reiterate the point, I use this WHO map, which again is a bit old. I'm still looking for the updated one. But here, what you realize is that you look across the geographical regions of the world, you see that we have problems in Africa. We have problems in Africa. PM 2.5 levels is greater than 35 microgram per meter cube. But the problem here is that, is this data actually reflective of the situation in Africa? If you look at some areas in Sub-Asia to same, but let's focus on Africa. Is it reflective of the situation in Africa? It's a yes and no. The reason I say that is that, I mean, everybody on this call knows that there is limited ground monitoring on the continent. And Christy tried to point to some of those issues. So therefore, where is this data coming from? Largely from satellites, aerosol optical depth. And we also know that this satellite is 1 hour overpass. Also, when you have cloud cover, then again, there are issues. So therefore, if we have this representing Africa, it could be that the levels are even higher than what has been reported, or it could be lower than what has been reported. And that is the more reason why there is the need to bridge these data gaps using ground monitoring. And that is also, there is a need for us to validate some of these satellite measurements, validate these low-cost measurements, which now are trying to address the data gaps. And we have a project in Accra here that is doing something massive on this content. And I think that is the more reason why the forecasting work that has been done by WRI, Christie and his people is very good, you know, to address this concern that I'm raising here this morning or afternoon, wherever you find yourself. Again, we live in a continent where about 75 to 80+% of the population, because of poverty, social deprivation, are using biomass fuels or dirty fuels, some might put it that way, for cooking and heating in the household. And this generates massive amount of air pollution in the household space, something we call household air pollution. And you have women who are cooking for us, you have their young children that they attend to, and they bring them to the kitchen and are exposed to these high levels of pollution. But importantly, this household air pollution also filters into the ambient environment. And so it's also one of the major contributors to ambient air pollution. And I think a work that was done by, is it the State of the Air? I think somewhere in Ghana, maybe 2019, pointed to this fact. So what you see here is monitoring in geographical regions across the world. PM 2.5, PM 10 concentration, 2010 to 2019. And it's from a recent report by the Chicago Energy Institute. Yeah. Chicago Energy Institute. Yeah, so what you see here is that if you look at Africa, where we find ourselves, you realize that this more or less alludes to what I said earlier on about the limited ground monitoring that is it you see in Africa compared to North America, which is doing well as well. So it means there are huge air quality data gaps. This is for NO2, nitrogen dioxide. And then you realize that next to nothing happens on the continent. So in terms of gas monitoring, next to nothing happens on the continent. And NO2 is a traffic pollutant. It's also one of the criteria air pollutants. So it's important that it's in as much as, so the reason why I bring this into the discussion is that you realize that there is overemphasis on PM monitoring. All these low-cost sensors that have been developed are for doing PM, which is fine. I mean, particulate matter less than 2.5 microgram is the most deadly for health. But NO2 monitoring is also very, very important. So in as much as the focus is on bridging the PM 2.5 data gap, we also need to look at how we can quickly bridge the NO2 data gap as well. Then in the same report, you see countries in high and medium-high opportunity band representing locations where there are greatest opportunity to fill PM 2.5 data gaps. So what this chart tried to posit is trying to look at countries where there are opportunities, massive opportunities to bridge the data gap. And it's instructive to know that there are many, many opportunities in Africa, as you can see from the chart. The key question here is that why are we not leveraging these opportunities? And what are these opportunities? So I think the discussion subsequently will help us to uncover what these opportunities are that enables us to fill these PM 2.5 gaps. I think I have a few, and then when we come to the discussion session, I'll be able to elucidate or share more light on that. But what are these opportunities? And again, what is it that is stopping us from leveraging these opportunities to fill the PM 2.5 data gaps? But again, here you see again what I was talking about. Emphasis is on PM 2.5, but we're not talking about the other gases like NO2 or sulfur dioxide, which should also be on the table. I mean, not to stretch anything, but just to emphasize that air pollution virtually affects every organ or system in the body. And I'm an epidemiologist. I do air pollution health effect studies. And the more reason why we need to bridge this data gap. My colleague before me talked about the limited epidemiological studies from the continent. But of course, we need the data. We need the air pollution data to be able to do the epidemiological studies. Even on the outcome side too, there is a problem. On the outcome side, we have poor record keeping in our hospitals. To assess the outcome itself is also a problem. So in as much as we are doing this, we have to set in motion a system that will also help us to surveillance for air pollution related diseases, as I put them. Same pollution is killing about 7 million people every year. In Africa, about 1 million are dying every year from air pollution. But again, these numbers, are they reflective of the situation in Africa? And I've alluded to the fact that we have limited data, we are leveraging satellite data, and also there is limited epidemiological studies on the continent. And I'll tie this to the exposure response functions that are used in estimating the burden of diseases across the world. I mean, there's limited epidemiological studies from the continent, so we don't have the risk, relative risk that goes into these functions. So basically, the studies that are in there are European and North American estimates. And how applicable is these exposure response functions to Africa? That is also something that we can delve into later. So I think one of the things that we can do to bridge the gap is to leverage these low-cost sensors. There's a boom, there's a proliferation of low-cost sensors, ranging from $100 to about $5,000. Some of them are very, very promising. There are projects on the continent. ECHO is represented. They are doing very good work on the continent, building their own sensors that are tailored to the rigors of our cities, which can be leveraged to bridge the data gap. So I think that is something that we need to, is one opportunity that we need to take. We need to grab with both hands to be, yes, I understand there are data quality issues with the use of these low-cost sensors. But then again, there are also studies that have developed correction factors for some of these low-cost sensors. And so, I mean, whatever we measure, which are indicative measurement, we can correct for them, and then they become very good. But what I keep on saying is that in an environment where we have no measures, anything that is indicative is fine for a start. So these are some of the reasons why we need to leverage these low-cost sensors to bridge the data gap in Africa. I don't want to bore you too much, but the key thing is what I talked about previously, that the integrated exposure response functions that are used to estimate the GBD attributable to air pollution are based on data from North America and Western Europe, and therefore they have limited application in Africa. So we need to get to a point whereby we are also generating local evidence on the continent to inform these functions, so that the burden of diseases that are attributed to Africa, that are estimated to us, we can have very confidence, we can have some level of confidence in them. And again, it can help to influence this air pollution control decision making. And these are some of the strengths. Again, some of these things are very elementary, and I don't want to bore you with that. But just to highlight that we have been doing things in Ghana here to bridge this air quality data gap. So in 2019, from my very own meager salary, we implemented these Ghana Urban Air Quality Project. And the goal was simple: to deploy a mixture of low-cost sensors and reference grade monitors in Accra and other metropolitan areas just to bridge the data gaps. But importantly, we are also using these sensors to conduct some very good epidemiological studies. And I must indicate that this project anchors our flagship Breathe Accra project, which is funded by Clean Air Fund. And again, we are working with 15 metropolitan assemblies in Ghana, where we have deployed so far about 60 monitors across the Accra landscape. We are also building capacity. So one of the opportunities that I think we are not leveraging is that you have district assemblies where you have staff who are trained in environmental health, and some of these people can do air pollution work, air pollution monitoring. But unfortunately, in Ghana, we find the air pollution program centralized at the EPA. So this is one of the opportunities we have identified. And by virtue of that, we have been building capacity of the district assembly staff to own an air quality program in their assemblies, monitor air quality in their jurisdiction. And it's very refreshing to indicate that presently there's a bill that is being considered in Parliament, which is now going to give the mandate to these district assemblies to monitor air quality in their space. So these are some of the objectives. We have a website where all our data is open access. As I indicated, we are building capacity. We are also building capacity, not only capacity in monitoring, but as I indicated, on the outcome side too, there's a problem. We don't know the extent of diseases that are attributable to air pollution. And if you don't have that information, it's very difficult to convince government to invest in air pollution control. So we are also building capacity of health authorities to mount surveillance for air pollution related diseases. And some of the health authorities that we are working with have embraced this idea, and they have started this initiative in their districts. So this is our website. That is the census that you see there. And when you click in real time, you'll be able to know the air quality levels in that location. This is our deployment map that we have been using to deploy. The plan is to have at least 5 sensors in each of the districts we are working with. And then also we have some reference date monitors, which we have dotted around for calibration, etc. So in conclusion, in sub-Saharan Africa, in the short to medium term, low-cost sensors should be leveraged over the prohibitively expensive regulatory and reference instrumentation. In the long term, investment in regulatory instrumentation, no matter how limited they will be, is recommended for periodically calibrating sensor network and developing correction factors. It helps to address data quality issues and inspire public confidence in the policies and regulations and research findings emanating from such air pollution. Thank you very much.
Thanks, Kofi, for that presentation. It's actually quite interesting. We've been talking a lot about PM, and we actually do tend to forget there are some very important gas phase pollutants that we actually don't understand them very well in this continent. That was really an exciting presentation, and I'll make a point to look at some of the papers that you shared, quite interesting. So let's keep talking about this issue. Let's keep thinking about how we can support each other, how we can work together, and how we can promote also African solutions to these challenges as we move forward. So mine is to really thank the presenters. That was really an excellent presentation and discussion. We had requested the WRI Global to give us an opportunity to have an African discussion because the other discussions we usually do Africa, Latin America, and Asia usually occur at a very late hour that most of us have not been able to attend. So this was really excellent, and the discussion was quite powerful. And I want to take it back to Amos on the way forward before we close it.
Yes, thanks a lot, George. And again, thanks to all the presenters who we had. It's been a very rich session, to be honest, even for in terms of building capacity across the board. So we are going to be, we are coming to a close for this session. Thanks to all of you for showing up your faces really thank you, everyone. And bye for now, but see you next time.